know, given the magnitude of the budget problem, we're still forced to make reductions in programs and services that we thought we'd never have to make. We know that these reductions are going to harm individuals. We also know that the people that provide the services are going to be hurt. Communities are going to be hurt. Employees will be losing their jobs. It's a very difficult budget. So we do want you to know that we sat through the budget discussions for every single area within the budget, and everyone is taking cuts. Everyone is hit very hard. This is a huge deficit that we've had to try to deal with. So we have limited time today. We're going to I'll walk through pretty quickly the major areas that we thought you might be interested in, and then the team will be able to answer specific questions. So health programs that are eliminated. We are eliminating the basic health plan, the Disability Lifeline Medical Program, the Children's Health Program, Medicare Part D copay, and state funding for family planning grants in the Department of Health. The only family planning dollars we retained were those where we get the 90% Medicaid match. What we maintain in health is the alien emergency medical or the kidney dialysis and cancer treatment, the hospice program, the pharmacy program, the physical, occupational, and speech therapy, and the Take Charge family planning. Those are maintained in both the supplemental budget and the biennial budget. Medicaid services that are reduced include the adult non-emergency dental and the maternity support program. Programs that will be suspended in the supplemental but we're restoring in the biennial budget are adult vision and adult hearing. Both of those are the hardware. And then we restore 50% of the community clinic grants. The Medicaid programs that will be eliminated are the school-based medical service reimbursements, medical interpreter services, and podiatric physician reimbursements. For long-term care and developmental disabilities, we reduced in-home Medicaid personal care hours by 10%. We delay enhanced training for home care workers. We closed Francis Haddon Morgan this biennium and Yakima Valley School by January 2012. We continued the reduced funding for the Senior Citizen Services Act by $1.2 million next biennium, and the reduction for the area agencies on aging rate for $1.5 million. We're eliminating the nursing home rate financing allowance and modifying the nursing home rate for the lowest acuity patients. We did not propose shifting from agency providers to individual providers. We also did not propose the utility tax or the nursing home quality assessment that was included in the Department of Social and Health Services budget. We do reduce the residential provider rates for supported living providers that was included in the department's budget. And we reduce employment and day program rates and funding for state-only employment and day. We also add 58 new community residential placements for individuals who will be leaving other state care. And we have funding for employment and day for waiver clients who will be graduating.
Hi, I'm Donna Patrick with the Washington State Developmental Disabilities Council.
And I'm Diana Stadden with the Arc of Washington State.
We've just finished hearing a briefing by the Governor's Policy and Budget staff on health and human services issues for the Governor's biennial budget, which she will be presenting to the public in a few minutes.
And one of the most interesting pieces of it to me was the fact that she is proposing to close Francis Haddon Morgan Center at the end of this year and close Yakima Valley by January 2012. And in addition to this, they will be putting forward legislation that's necessary to implement the budget. They call that NTIB, that will make the residential habilitation centers, our state institutions, for people 21 and over only. And they will also revise the legislation with the names of the RHCs in them to eliminate Francis Haddon Morgan and Yakima.
We're thrilled about this. Another proposal is that even though the letters have gone out to eliminate or suspend the Individual and Family Services Program, the governor, for the rest of this biennium, which is through June 30th, 2011, the governor does propose to reinstate that, and I think it's a 10% reduction.
Well, what the reduction said was it's a $1 million reduction, and that's to a $12.3 million program. They are not sure how they're going to take that reduction, whether it will be taking a little bit from each family or the number of families that will be put back on it. We'll have to wait and see how that one shakes out.
The other thing is the biennial budget starting July 1, 2011 does restore SIBs, so that the rest of, we have 62 families on it now, and it restores it to 100.
And SIBS is a Children's Intensive In-Home Behavior Supports Program. We also had pharmacy saved. That was a big issue for a lot of people. We were quite concerned when they were talking about eliminating the pharmacy benefit, and they have restored that as the legislature wanted as well. And then the dental is going to also be restored to some degree.
And they are maintaining the 10% reduction in hours to Medicaid personal care.
And the physical therapy, the occupational therapy, speech therapy, all of those things have been restored as well.
The governor is going to propose some community respite beds, a number of new community respite or community residential placements, using roads to community living, and a mobile crisis unit to be used where
So
it's
there
needed.
will be 58 new slots
residential.
for residential. They did not take the utility tax that the department was putting forward, although we know residential providers are also working on that.
Yes, the legislature's free to go ahead and do it.
They will have a summary coming out as soon as the governor does her briefing, and we will be posting that on the Arc of Washington website at www.arcwa.org. So be sure to check and see all the details as we learn them, and we will continue to update that list as well as we learn more.
Thank you very much.